I was canceled due to medical marijuana. So I was interviewed at length by a news organization who wanted to talk about the Adderall and stimulant medication shortage in America and the approaches that we are taking to help our patients. Then the producer found out that I was a medical cannabis certifying doctor, and they gave me the boot and they pulled the article. Let's talk about it. Hey everybody, it's Dr. David. So beyond what I do on my social media platforms, I've always made myself very available to all types of news organizations, um, from local to regional, national press, both in print, on TV. In fact, if you want to see the different things that I've been involved with and all the different news organizations, if you go to drdavidmd.com, you'll be able to see all of those different organizations that I have shared my knowledge with. And so it's one of those things that I feel I want to educate people. I want to help people understand what is going on. And so when this news organization contacted me, even though, of course, I'm one who takes more holistic approaches to ADD, attention deficit disorder, I certainly do use medications. And if anybody wants to hear my take on it, I'm more than happy to share it with them. So I was contacted by this organization. I'm not going to say their name because of what they did, and I don't want to grace them having me utter their name. But at the same, they contacted me. Hey, we have this urgent news article. We need to run this. Are you available for 10 minutes? It actually went on for 20 minutes. I actually shifted some of my patients around in order to accommodate them. Okay, and it was a really, really good interview. I thought, I talked about, for our patients who are on medication, talked about how they can skip weekends if they need to kind of stretch it out more, how there may be other medications that are available. But of course, I then talked about the things that I do, looking at diet and nutrition and supplements and omega-3 fatty acids and counseling and educational coaching, all the things that I would share with a patient at any time. And he was really pleased with it, and he said that he would get back. He would get back just to make sure that he represented me properly. But then a few hours later, we get this email. So sorry, our producer, after learning that you are a medical cannabis certifying doctor, especially for children, and she's against that, so she's not going to run your story. So after missing out on a patient, which I could have helped somebody else because we had to shift everybody around, then I got canceled. First time I think I've ever been canceled. So how about that? I get to join that club. But of course, it was, in my opinion at least, one of the most ridiculous things to be canceled over, okay? We are now at a point in America where 88% of people are in favor of medical cannabis, right? It's no longer a rogue thing. It's bipartisan. It's probably the most popular thing in America besides puppy dogs and Santa Claus. And it's an issue that I'm very comfortable talking about because there's almost universal acceptance on it. I didn't talk about medical cannabis during that interview. It was something that they looked on my website afterwards. Wouldn't it have been nice if they would have looked at my website ahead of time? Because, of course, I am not shy about my support and my experience using medical cannabis, not just for adults, but, of course, for kids. And what I've seen over the years in terms of helping people with autism, especially in terms of the anxiety, their behaviors, especially their violent and irritable behaviors, especially when they hit puberty and things really can get out of control, we have so often seen kids improve. Kids who would have ordinarily potentially had to be institutionalized. We know that families split up because of the stress so much. We've kept families together because of the judicious use of medical cannabis. And of course, as I've talked about, not just using THC, but all the other cannabinoids like CBD and CBG and CBGA and CBN, we do true med management here. And, I realize that not all doctors in the state who are certified, have any experience whatsoever, because as you may know, their only course that a medical cannabis certifying physician has to take is all about the bureaucracy and how to enter patients into the registry, how to put the milligrams and what routes of administration. But there's not a lick of anything that the doctor needs to do to learn about the treatment itself, which, of course, that's pretty pathetic. But being a holistic doctor and somebody who has worked with herbs in children for 25 years and having been coming up with my own herbal protocols for all types of supplements as well, I was able to apply the same thing here and take this very low, slow, gradual, one change at a time in terms of how to introduce the various products. But not just that, but suggesting the types of products to look for. And of course, not of course, every one of our patients after their first appointment sees our patient educator, where we actually have a full education room where the different dispensaries have their own shelf with blanks in it, of course, but we're able to show them, like, this is what a meter dose inhaler looks like. There's one that looks like an asthma puffer. This is what different types of vaporized cartridges can look like. These are, other types of things as well, because we want to educate our patients. We educate them about the various terpenes and what their effects are and how to look for them and how to look at certificates of analysis to make sure that what's in the product, of course, is what it says. Now, in the dispensaries, that's not a big deal, or problem, I should say, because they have to report it to the state, and of course the state would catch it if there was some mislabeling. The label says one thing and the certificate of analysis says something else. But nonetheless, being a functional medicine doctor, I am always, the most basic question: how are you functioning? Are you doing better, or your kid doing better, or things doing worse? And are there any side effects or any concerns about what we are doing? Okay. And of course, as I mentioned, THC really should be a last effort type of thing after going through other treatments. But oh my gosh, what I have seen. And that's not even taking into account the kids and the other patients that I've seen who are on chemo and who are tolerating their chemo or their radiation only because they're doing medical cannabis, as well as our PTSD patients and our pain patients, whether it's chronic neurological pain or chronic muscular or joint pain, it helps so many things. And of course, if there's a doctor who can actually say, look to these types of terpenes or these types of dosing protocols, here's how you bring it in. And especially since so many of our patients are newbies, whether it's kids who've never done it before, or adults, and especially seniors who have never done it before. And let's face it, if you don't know what you're doing, you could kind of whack yourself out if you don't know. And so having somebody who's there to hold your hand, having an educator who's also available at any time when we're open to answer those types of questions, that's something that I think, first of all, everybody should do that. Every physician should do that. It's a shame that they don't. But we want to make sure and let you know that that's what we do around here, because we need to be there to support you, not just to certify you. Okay, so overall, that's, it's sad. I mean, again, it happened. Obviously I think, I don't know if we need to vet the people more, to see if there was anything in their literature about medical cannabis or anything else that I support. But yeah, you kind of hope that a reporter would vet us before wanting to interview in the first place. All right, so there you go. That's what happened. I haven't said it in a while, but if you do like this content and you're not subscribed, please do so. Please share it with others as well. Have a great day.